healthcare sector has frequently lagged behind other industries when it comes to technology and customer service development. Today, the empowered customers are no more willing to wait long hours or endure poor services because they have no other option to go. In today's modern healthcare era, technologies are able to provide easier and more seamless experience, physician-patient interaction via smartphones, video conferencing, and enabling reward points by usage of mobile phones. Gamification to encourage patients' healthy behavior. All this gives a sense that healthcare industry is focusing towards providing a superior experience. Hereby, I invite Mr. Ashutosh Lawania, an angel investor, co-founder of Myntra, MFine, to share his thoughts on consumer-centric design strategies for better care delivery and patient engagement, learning from the retail industry.
Hello. So good afternoon, everybody. So first of all, let me introduce myself. And in fact, MFine. So I am co-founder of MFine. And since I come from technology background and very, very new to healthcare industry, so I thought like, okay, let me just give a brief introduction what we have been doing. See, we are trying to create a virtual hospital and aggregating topmost hospitals of India on our platform to solve two problems in primary and secondary healthcare delivery. Number one, how we can create a platform where consumers can get on-demand or instant access of healthcare. And secondly, how we can bring standardization and enhance quality in healthcare delivery. Since my prior experience is with retail industry, I would share certain perspective how retail industry or any other category has been changing the consumer experience, the way they have been interacting and engaging with the consumers, and what has been happening outside world. So idea of this talk is share examples, share inspirations from other industries to this healthcare industry, and if we could learn something from there. I know you can't exactly copy paste things, and healthcare industry is very, very different. And I completely agree with Dr. Malpani's view, because he said like a lot of entrepreneurs have come from tech side, but they have not brought that perspective that, okay, healthcare is a very, very different industry. So we can't really copy paste, but still, let's look at some of those things and take inspiration and try to implement. So I would like to share few principles or new age concepts in other categories as well as in retail. And having that experience, probably we know like, okay, we were quite obsessed about these things while we were building retail business. So I would like to share some of these. The first and foremost thing is, for every category, and especially in retail, how we can build easy and fast access. If you look at in today's world, if I want to buy clothes, if I want to buy anything, it's pretty much available right there on a click of a button. All other categories are trying to build those strategies how we could be easily accessible to the consumers. How fast we could reach out to the consumer. Not sure how many of you have used Dunzo and Swiggy's kind of applications. 15 minutes delivery, 20 minutes delivery, all such kind of consumer experience are getting built. Then I come to second principle, choices and more choices. The world is moving in that direction where retailers or in other categories, people are presenting many choices to the consumers. Other day, I was trying to shop a shirt from Amazon, and I just put down a keyword shirts. There were 2 lakh options presented in front of me. I am sure all of you would be using Netflix, Prime Videos. If you look at like entertainment content, like thousands of movies are pretty much right available in front of you. So world is moving in that direction. Third thing is uncompromised quality. In today's world, where information is so accessible, a single mistake can be very, very costly in terms of consumer experience. You commit a mistake, you deliver a poor experience to a consumer, it would be right there on Twitter, it would be right there on Facebook, thousands of people would have commented, and your NPS score would have been coming down. So we can't actually compromise with the quality of delivery. Fourth concept, personalized experience. In retail, online retail, people would have built so many strategies to know consumer is doing exactly what. If he has come to a particular place, clicked something, system understand. People have implemented beacon technologies. As soon as you enter in the store, they know what exactly you are doing, which way you are moving. All that data has been getting processed, and a lot of personalized experience has been given to the consumers. Then last, engagement at every touch point. So it's like, okay, every touch point, businesses and brands are getting engaged with the consumers, presenting a lot of content, a lot of scenarios, and attracting their attention towards their brand or service. I just would like to share one video. I'm sure a few of you guys would have definitely looked at this. This is Mercy's virtual care center. Idea is like, okay, how other countries have been pretty much like, okay, trying to redefine the experience in healthcare. Okay, can we have audio, please? Just a minute.
They don't get out of the home much other than going to the hospital. Many times they end up in the emergency room. They have continual needs, but our current healthcare systems meet them episodically. Patient care is often fragmented, and because of that, our system tends to be more reactive. And everyone on our team at the Virtual Care Center recognizes a need to change how we provide care to patients in a way that will better benefit the patient. Technology allows us to do that. At Mercy Virtual, there's nothing virtual about our virtual care. We get to know the patients, we get to know their family, we get to know their other caregivers. So we're building a relationship with them while we're empowering them to play a role in their own healthcare. We're actually able to spend more time with patients than in the traditional setting. We're not substituting for the current bedside or traditional care team. What we're doing is we're augmenting what they currently do. So one of the advantages of virtual care is that we're ever present. We can follow up on testing, we can follow up on medical interventions, and we know what each care team member is actually doing. Everyone in our program needs to be comfortable with change. So don't question if change is okay. The question is it in the patient's best interest? And if so, then we should do it. I see the future of medicine being that we don't refer to virtual care as virtual care. I think it will become standard of care. Virtual care creating the continuum, filling the gaps that currently exist will become the norm. We're just scratching the surface. We're just getting started.
So let me just talk about some of the ideas, or probably you can say like okay, strategies, what hospitals or healthcare systems can look forward. And these are some of the systems which have scaled in other geographies, and there's no harm in taking inspiration from these examples. So first is the concept of omnicare. And in the context of India, where we know the consumers are pretty much like, okay, moving on to a virtual world. There are 300 million smartphone users at this point of time in India. By 2020, half of the India would be on smartphone. So it is very much required for healthcare provider systems to be present on all the channels. When your consumer is moving over there, you can't just be stuck to a physical channel. So can we look at like a system which is an omni-care system? Okay, so care beyond physical system. Let me just share an example. I am a patient. I come to the internet. Okay, I looked at whatever service, booked an appointment, came to the hospital. Now I would like to again connect back to the hospital. Can hospital be present on a virtual system where I can seamlessly connect with the same doctor, with the same hospital? Can I create my hospital in a virtual world where that could be a first port of call? Okay, I come, pretty much discuss with the doctor, and then make a physical visit for showing the report or probably for, further secondary or tertiary care. So typical consumer behavior is like, okay, I'm searching on internet, booking an appointment, pretty much coming on the social media, writing feedback. So consumer is present across channels. We need to build presence across channel to pretty much provide better engagement or reach out to more consumers. I will share one case study. I'm not sure how many people are aware of that. As a tech entrepreneur, we have been having that principle, like, okay, let's follow mature countries, mature markets, or countries where technology advancement have been happening. So China, US already sort of a role model where we keep following up what has been happening over there. So Ping and Good Doctor is Ping is a big insurance group, and they have launched a Good Doctor platform. They have created a platform where 3,000 hospitals have created their virtual outpatient centers. And this is the real data, 4 lakh consultations and queries per day have been happening. This is the scale. And 30,000 doctors have been delivering care on that platform. So this is first one. Let me share the second trend, video. I am sure everybody have been using videos for their interaction in various contexts. I think it could be a new channel to establish doctor-patient relationship. So far, there has been an engagement in a in-person environment, pretty much within the outpatient setting. Why can't we create same environment on a virtual medium? So let me just share like okay, some of the facts. Indians are topping on like okay WhatsApp video consumption. 50 million minutes per day video calls have been happening. And this is total 14.7% of overall WhatsApp video call. So look at the consumer behavior. 18 crores of users every month have been watching YouTube videos. So basically consumers are pretty much familiar and have moved on to video conversation. And that would be the next big trend. I just want to share one more data point. Kaiser Permanente, which is a largest HMO in health management organization in USA, they witnessed 21% virtual visit to the hospital. And they are expecting this will go to 50% by 2020. So this is the second trend. So another, this is another trend I would like to talk about. And see, so far, healthcare industry has been giving, in terms of prescription medicines, tests, and treatments. Why can't be health tools? Those are digital health tools, which could come in the life of patient as well as in the life of doctor, which could be recommended. I'm just taking one fine example, how we are trying to build engagement. See, doctor has given prescription, how we can build adherence towards prescription. So medication reminder is fabulous way to build engagement. And we have done survey at least with our consumer and we saw like 30% of the consumers said this is the most useful tool that they found at M5. Similarly, having a periodical intervention with the consumer and checking proactively whether he has been recovering or not. See, patient goes from the OPD room. Are we geared up to track like okay whether he is improving or not improving? Can we create those systems? Suppose we define like okay, yes, your fever should come down in 2 days. Can we again go back to the consumer and check whether your fever has come down or not? It could be any mechanism. I have presented a app solution, but it could be a simple SMS also, where consumer can say, yes, I am recovering, I am not recovering. Not recovering, we could react the different way, or recovering, we could react different way. So this is another way to just engage with the consumer. I will talk about this, I think going very slow. This is pregnancy and ovulation tracker, which has been created by Flow. 10 million women are using this simple app. So all these kind of digital tools can come in patient life and which could definitely enhance the patient experience, at the same time can build engagement between patient and healthcare systems. Again, I will take example of Pingen, and this is a very different example, and just wanted to share if any like okay healthcare system is interested to try out such kind of model, and it is called Pingen Good Doctor 1 Minute Clinic. So it's a very simple kiosk where there are some commonly available drugs which can be dispensed in self-served way. It's a simple room. You get into that room and connect with the doctor on a virtual medium. They have already they have launched 1,000 clinics in 8 provinces, and 3 million patients have been served by these kiosks. Again, coming back to Beacons technology, which has been a trend in retail. It's a very simple technology where in a close proximity, devices can interact with each other. And since it is running on very low power, the battery life of the beacons are very, very huge. So you can pretty much deploy that and interact with the consumer device and provide a very personalized experience, engage with them at every intervention. So example, can we just do better management of OPD queue? Patient has come, he is waiting. Can you send a message? Okay, your number is next. Yeah, it happens. Okay, in some hospital it happens in a manual manner. Some hospital it happens on a screen. But uh, definitely getting a notification on mobile and with the personal touch, like okay, the experience could be very, very different. You can always push very relevant content at the time when consumer is present in OPD. You can always like okay share a lot of offers or promotions and all those when like okay somebody is over there. If you want to promote, like okay, usually I'm not a great fan of like okay promoting something when consumer is or patient is not feeling well, but I'm just sharing that idea. Content and communities. um, there is a site, Patient Like Me. They have got 600,000 patient community. Communities are great way to engage with the patient. Generally, patient interact with the similar patient, try to know more and try to build trust and build their awareness also. So if we could take that strategy and probably on a website of hospital, just create a simple like a community tool, download that, implement that, and then categorize patient, provide a platform to interact like okay one patient group with another patient group. So that starts building trust with the hospital, at the same time more and more engagement. Then on that platform, like okay, one can use video and textual content also to promote a lot of medical, not to promote, to build awareness with the consumer around medical terms and um, tools. And then lastly, see, fundamentally our objective should be patient, should be going in the direction where he is following healthier lifestyle, how we can reward patient in that direction, if, and like nudge them. Example could be like okay, if you are doing some preventive health checkup, and if hospital has defined like okay, certain health goals, and if patient are achieving that, how we can incentivize. That would be another way to build engagement, at the same time provide a better experience and better care to the consumer. And then there could be subscription model also, which retail has been definitely like okay, have launched a lot of like okay, if you look at like okay, Prime Video, Netflix, and all those are subscription model. Can we have such kind of models in healthcare segment also? So far we have not seen much, but definitely worth a thought. Yeah, pretty much this is what I wanted to share. Happy to take up any question. I hope it is useful content for you guys, and you would have learned something new.
We have a question.
Astos,
Yeah.
very nice presentation. What it appears to me that you are trying to implement so many things which is already there in retail, non-healthcare sector, and trying to see the possibility of using that.
Correct.
My question is that, have you really tried to, you means your organization, has you really tried to understand the patient's perspective, the user's perspective? What is the real problem they have? You have so many solutions, but what is their problem? And it is not your problem, their problem. Dr. Malpani was saying in the morning itself, ki you should think from the patient's point of view. My question is very straight. I think you understood my question, right?
Yes.
Have you done any study to understand the patient perspective and then solving the problem, not having a solution then finding out the
Correct,
problem?
correct. So, yes, I can definitely share in the context of MFine. I didn't bring over here because I thought it's not very useful. But we are not solving all problems. We have picked only 2 problems. Okay, we understand there is a poor doctor-patient ratio, and at the speed doctors are coming, definitely it is not going to solve that problem in future. So how we can build access to quality health care to the consumers? So that is number 1 problem that we are fixing. As I talked about in the beginnings, second question is how we could standardize the care by pretty much giving great technology in the hands of the doctor, which is assisting them and improving the overall care quality. For that, we are using 2 fundamental routes. One is mobile internet, which is pretty much like, okay, growing very fast. So it is great way to build access to the consumer. Secondly, AI and machine learning, where you pretty much ingest a lot of data and generate, like create millions of records to train the system, and which could be a sort of an assistant to the doctor, helping them in their care delivery process. So these are the 2 things we have been attempting at MFine. Any other question?
I think we'll continue.
Thank you, guys. Thanks for your patience.
Thank you so much, sir. I would request Mr. Ayanki Murli Krishna, former Raja Ramanna DRDO Distinguished Fellow, Government of India, Professor and Director, Jain Technology University, Hyderabad, to present the memento to Mr. Ashutosh Lavanya.